All right, I think we'll go ahead and get started. Thank you so much for joining us this morning. I have the pleasure of having two amazing people here with us today to talk about caregiving in the US 2025. I am Lisa Weber-Raley. I'm the Chief Research Officer at Greenwald Research. I'm also the most senior healthcare researcher, and one of my focus areas is caregiving. So I'm very excited to have this time and space to talk today about some of the latest data about the state of family caregivers in the United States. So without further ado, I'm going to introduce our panelists for today. First, we have Rita Choula, who is Interim Vice President of Family, Home, and Community and the Senior Director of Caregiving at AARP Public Policy Institute. Rita is a leading voice in bridging caregiving policy, research, and practice. She's known for her commitment to ensuring that the lived experiences of family caregivers are not only heard, but central to designing solutions that meet their real world needs. In her role, she leads strategic initiatives that embed caregiver supports into healthcare, social services, and public policy. Her work encompasses a range of things, including large-scale initiatives, working with key collaborators in the development of tools and programs, obviously research, which is what Rita is here to talk with us today about, and policy implementation with a focus on family caregiver inclusion in hospital at home programs and the utilization of Medicare caregiver training codes. Rita is a trusted advocate within the caregiving community. She speaks nationally on the challenges facing family caregivers and solutions to better engage and support them. She draws from her lived experience as a caregiver, caring first for her grandmother, and then as a sandwich caregiver, caring for her mother while raising two young children and working full time. That personal journey fuels Rita's commitment to ensuring caregivers are seen, supported, and valued. So welcome, Rita. Thank you for joining us. Next, I have Jason Resendez, who is President and CEO of National Alliance for Caregiving. Jason is a nationally recognized care advocate. As President and CEO of the National Alliance for Caregiving, he leads system change efforts to value and support our nation's more than 63 million family caregivers. In 2023, Jason was named one of the most consequential leaders in health and medicine by Stat News. Prior to joining National Alliance for Caregiving, Jason was the founding executive director of the Us Against Alzheimer's Center for Brain Health Equity. He pioneered the concept of brain health equity through peer-reviewed research, public health partnerships, and public policy. In 2020, Jason was named one of America's top influencers in aging by PBS's Next Avenue, alongside a name you all might recognize, Michael J. Fox. He has been quoted by various media outlets, including the New York Times, the Washington Post, the Wall Street Journal, and Univision, on issues related to caregiving and healthcare. Jason is from South Texas and graduated from Georgetown University. Welcome, Jason. For the bulk of today's webinar, Rita and Jason will be walking us through some of the key findings from Caregiving in the US 2025. And we'll end with a discussion about what those findings mean for how we in the health and wealth industries might better support caregivers. If you have questions during Rita and Jason's presentation, please put those into the Q&A box down the bottom of your Zoom screen. I'll be monitoring those questions and we'll raise them at the end when we have our discussion portion. So at this time, I'd like to turn it over to you, Jason.
Great. Thank you so much. I'm going to share my screen, so please bear with me. But it's such a pleasure to join Rita, as always, and then also you, Lisa, to celebrate Greenwald's 40th anniversary. Greenwald and you have been a key partner to us in bringing the vision of caregiving in the U.S. to life. Really thrilled to share some key insights from Caregiving in the U.S., a partnership between the National Alliance for Caregiving and AARP. And really, we're focused on leveraging data to accelerate change for family caregivers. Caregiving in the US is what we consider the deepest dive into the day-to-day challenges confronting family caregivers of older adults, people with a serious illness, or a disability. It's what gives us an understanding of how caregiving has changed over time. This is something we envisioned in the 1990s and have carried out in partnership with AARP, that helps us to better understand the realities that America's family caregivers face, and also gives us the opportunity to measure how our nation and how our communities are responding to our growing prevalence of family caregivers. What are we doing to support them? And what are we doing to overlook them? And our research captures the consequences of that inaction. This is something we've been tackling for 28 years, delivering insights that shape the national media narrative on family caregiving and also the national policy landscape on family caregiving. It's become an essential resource for elected officials, for advocates, and for family caregivers in addressing what is our shared care crisis. And I want to share a little bit about the tool as before we dive into the insights. Really robust methodology. We're really excited. This is the largest ever sample in the history of caregiving in the US, nearly 7,000 individuals who were surveyed in English and Spanish. With, I think, a really robust methodology that is, while we've innovated, we've also maintained consistency over the course of the project, which allows us to do time trends analysis. And also, I think really is setting the bar for how we think about and measure caregiving in the US. We measure a number of domains of family caregiving, from the living situation of the family caregiver, the financial situation, the well-being of family caregivers, use of technology. This is really a multi-dimensional look at family caregivers, making it one of the most rich data sets on the realities of family caregivers over time. And we couldn't do this without the expertise of folks across the care ecosystem. So we benefited from a diverse and dynamic group of external advisors who have guided us in terms of research methodology and approach, in terms of research interpretation and analysis, and also in dissemination. So want to give a big shout out to the folks on this screen and others who have influenced this project, not just for 2025, but in the history over the last 30 years. But now I want to dive into the key findings and our key insight. Sort of the thing that really stands out to us is I think a hopeful story, but still a challenging one, where we are seeing support systems start to expand in support for family caregivers, but the demand for family care is growing faster than we're able to put those support systems in place. And the data really bears out where that emerges across a number of domains, and we'll delve into those domains over the coming slides. I think the big picture, the thing that most people are interested in and always is an eye-opener, is just the growth of the family caregiver population. What we've seen between 2015 and 2025 is a nearly 50% growth in the number of folks enrolled in the ranks of family caregiving in this country. There's over 63 million individuals engaged in the day-to-day work of providing care, complex, demanding care for someone in their life with a serious illness, a complex condition, or disability. And this is what we call the floor, not the ceiling, of family caregivers in this country. That's nearly 1 in 4 Americans engaged in family caregiving. This is an issue that touches all aspects of American society in every community, in every state, in every congressional district. Caregiving is taking place right now. And there are some challenges, but also some opportunities that we see in the data. So who are family caregivers? Family caregiving cuts across all, like I said, aspects of society. So from age demographics to race ethnicity, to LGBT status. Caregiving is everybody, and everybody is caregiving. So as we think about some of the basics of the caregiver demographic profile, the average caregiver is 51, but 2 in 5 are under the age of 50. So I think that's always something important to call out, are the changing age demographics of care and how that's changed over the course of the project. And so there's an increasing need to focus on certainly supporting all segments of the care community, but especially those folks where there are less infrastructure and supports in place, including for young family caregivers. Um, Most family caregivers care for relatives, 40% for parents, 15% for spouses. I mean, I think really important to call out is that nearly 1 in 3 family caregivers are sandwich generation caregivers. One of the things that we recognize in this project, especially in this latest iteration, is that care happens on a spectrum. So the care that my mother provided for my grandmother who battled multiple chronic conditions and had a disability is part of the same spectrum of care that I provide for my son, who is a chaotic and amazing 3-year-old. And that spectrum of care in total is often undervalued and underinvested in. But there are nearly 1 in 3 Americans who are shouldering both sides of that care spectrum: care for an adult with a complex condition or disability, and care for a child. And so that, I think, is a really important call out, as there are unique policy solutions that need to be in place in order to support and recognize that care across multiple generations. Nearly 1 in 5 family caregivers has a disability themselves. So this is, again, a really truly intersectional issue. And so as we think about how hard caregiving already is, there are identities and realities that make that care even harder. Disability is one of those. And so really important for us to call that out. 1 in 10 identify as LGBTQ, cuts across all race, ethnicities. And then when we look at gender, this is one of the things that we've seen stay pretty stable from the course of the project, is the gender split between men and women. The majority of care in this country is shouldered by women. And you'll hear, I think, one of those stories today. But there are over 38%. So that's roughly around 24 million men providing care in this country in a system that is really gendered to support women providing care. So as we think about how do we raise the visibility of care and create gender equity within care, there's an increasing focus on valuing and recognizing the contributions that men bring to the caregiving role and space. And we're excited to be part of that with this project. And what are caregivers doing? So caregivers their role is far-reaching when it comes to providing care in this country. But family caregivers are managing care for recipients with multiple health challenges. Nearly 3/4 have 2 or more conditions. Nearly a quarter are managing multiple care recipients at once, so providing care for multiple people in the household. And then more than half are performing medical and nursing tasks. Yet only 22% of those individuals receive any kind of training. So caregiving is becoming more prevalent, as we've seen. It's becoming more demanding and more complex, more people providing care for people with multiple conditions, multiple care recipients. The complexity of that care being delivered is increasing. And so what we see is not a surprise that nearly 50% of family caregivers are in high intensity care situations. We measure that by the number of hours of care provided a week, and the number of activities of daily living, and the number of instrumental activities of daily living provided on a weekly basis. So given the trends that we're seeing around complexity, around the role shifts, it's not surprising to us to see that level of intensity be a hallmark of the care situation when support is not in place. I think that's important to recognize this. Caregiving doesn't need to be hard. It is hard because we don't have the right supports in place to make care more sustainable and less intense. And so we'll talk a little bit more about what those supports need to be later on. But sort of 7 of the big trends that we see shaping the caregiving experience in the US. One is just the prevalence of care. This is a huge community that represents a population bigger than the state of California. So this is again, the floor, not the ceiling. But we also see work while caring continue to be a key issue. So over half of family caregivers are providing care while working. Emotional stress continues to be part of the caregiving journey for the majority of family caregivers. More family caregivers are providing care for people with multiple health conditions, including chronic and serious illnesses. Um, Financial challenges continue to be a key issue associated with care. We're also seeing that more people are providing care for longer than they were in 2020. So, about 30% of family caregivers are providing care for individuals for 5 years or longer. So, complexity is increasing, duration is increasing. So, care is getting harder. But despite all those challenges, over half of family caregivers find purpose and meaning making in their care. And that I think is a sign of resilience, but family caregivers can't rely on purpose alone. There has to be more in place to support care. But I think at the end of the day, what we see is alongside those challenges, there's deep meaning and purpose. And that's what we need to invest in, is that meaning and purpose. But getting in the way of that meaning and purpose are a number of challenges that my colleague and partner in crime, Rita, will talk more about. So, Rita, I will turn it over to you to talk about the ripple effects of care.
Thanks, Jason. It's always a pleasure to partner with you on this and be a partner between AARP and NAC on this caregiving in the U.S. And I'm going to double your thanks to Lisa and to Greenwald for their work with us and partnership as well over the last 28 years in this work. So, yes, I'm going to speak to the ripple effects of caregiving. So you heard from Jason who that caregiver is and some of the impacts, but I want to go a little bit deeper into what are caregivers really facing as they're providing this care. Next slide. One of the things that we often don't think about is the caregiver well-being. So often professionals and others are focused on how that caregiver can better support the person they're caring for, but too often professionals and even caregivers themselves don't think about their own well-being. Well, from our study, we did see that 64% of caregivers share that they have moderate to high emotional stress. And this is caused by the things that they are doing in terms of providing care. As we dug deeper into what that well-being really looked like, we know that 1 in 5 caregivers report that their own health is fair or poor. And this is really something that we should be concerned about because as we are looking at individuals providing support to others, but they don't, for whatever reason, not having time, and that is often the case, not really looking at themselves and the care that they need. We're even showing that a quarter of these caregivers are experiencing even worse outcomes when they're living with the care recipient themselves. So again, not being able to really invest in their own health is something that is of great concern. We also see that 45% experience moderate to high physical strain from their caregiving duties. And so, what does that look like? That looks like someone maybe not knowing, and we'll talk about training in a little bit, but not knowing how to transfer someone, not having the skills or learning how to properly do things that are causing physical strain to themselves while, yes, they are supporting others. Nearly 1 in 4 caregivers, so 24%, report feeling alone. So we're looking at individuals that have emotional stress, that are practicing and dealing with very high physical strain, and they're not taking care of themselves, and they're alone. So in the midst of all that they're doing, a very high percentage is reporting feeling alone. Next slide. The financial impacts is something that we are increasingly becoming aware of. Again, when we look at family caregivers, there's this assumption that they're there to care for that individual and that there are no impacts on themselves and on their own lives. And what we're showing is that 47% are saying that they experience a negative impact. And so when you think about impacts, what does that look like? That looks like not being able to save. That looks like not being able to save long term for retirement or even short term. If we're looking at sandwich generation family caregivers, you're having to pay out of pocket for elder care and child care at the same time. We know that in terms of saving, more than 1 in 3 caregivers are not able to save. And so, what does that look like when you're stopped saving for your own needs to care for others? What happens when short-term things, your car breaks down, you need to invest in something for your child, you don't have the funds to be able to do that. And so in turn, it makes sense that 23% are then taking on more debt. And what does that look like? That looks like having to take out high interest credit cards and other loans. And 20% are not even able to pay their bills or they're paying them late, which again can have very dramatic consequences on an individual's financial wellness. We recognize that within Black and Latino family caregivers, that there is a higher level of financial impact. And that actually shows itself too with lower income and younger caregivers. As you heard Jason say, there is a higher level of younger caregivers now under 50. And so again, as we're looking at the financial the financial means and the needs of family caregivers, that financial hit really takes a huge impact. Next slide. Jason mentioned that 61% of family caregivers are working. They're working full or part-time jobs while they're providing a high level of care. And really within that working body, we know that that number goes up, that percentage goes up when we're looking at family caregivers working between the ages of 18 and 64. When we look at that age cohort, we're seeing 70% of individuals are trying to balance that work with care. And there are impacts that come with that. So if you're a family caregiver and you're trying to balance that work with care, what does that look like? We hear from caregivers 58%, they do things such as going in late, they leave early, or they have to take time off to provide care. We also know that 53% are paid hourly rather than the 40% that are paid on a salaried basis. And what we're seeing is that there are challenges, particularly with individuals that are making an hourly wage. It becomes very difficult when you're thinking about retail or other types of jobs where you're going in and you're on a schedule base. So it becomes very difficult to be able to build in flexibility and to be able to have employers offer those. So we're particularly looking and noticing the impacts on hourly wage workers. We also know that working caregivers are facing a greater financial strain than caregivers that aren't. And that may seem a little bit counterintuitive, but what we are seeing is that working caregivers are more likely to take on debt. Again, we go back to using up their savings and leaving bills unpaid. And so it makes sense then when we're looking at the emotional strain that we talked about, that becomes even more of an impact when you're working. Next slide. So I've mentioned several things where we're really looking at the difficulty with caregiving, the barriers, the challenges, but we also wanted to focus in on the glows. Next slide. So we have seen an increase since 2015 of supports for family caregivers that are working. Really, over the past decade, we are seeing an increase and acknowledgement by employers that there has to be something that they do. There has to be a role that employers take in better supporting their employees who are caregiving. And we've seen this in an increase in various workplace benefits. As you see here, things like paid sick days, there is opportunity for unpaid family leave. There's an increase in flexible work hours, as well as paid family leave. I think oftentimes we underestimate the importance of something like paid family leave, but for a caregiver who has access to vacation and paid family leave, that ability to use that vacation for time for yourself or your family that is not connected to family caregiving, but then really be able to use paid family leave to provide that care is a tremendous benefit for individuals. We also see things such as telecommuting and employee assistance programs. And again, salaried workers are much more likely to have access to these types of workplace benefits. And so there is work that needs to be done within the employer space to support all caregivers. Next slide. So Jason mentioned that there's purpose in care. One of the things that I think we find consistent, and those of you on this webinar who work with family caregivers or who are family caregivers, we hear all the time, yes, there are challenges and barriers, but they also find purpose in that care and they draw meaning on that care. And we see from this figure here that over half of family caregivers really talk about that sense of purpose, that sense of meaning that they get from family caregiving. Nearly half of family caregivers report long-term planning for their own future care. Oftentimes, when you're thrust into a crisis situation, it makes you step back and realize, wait a minute, I want to do something different so that when and if I'm in that similar situation, an individual providing care for me has some planning. They understand how I want to be cared for. Another piece that we see is a very important piece, and it's around the technology adoption among caregivers. Increasingly, we see things such as remote monitoring and other technologies that really support family caregivers as they work and seek to better care for someone, whether they're caring for someone in their own home or whether they're caring for someone long distance. One thing I wanted to point out around technology that I think is really important, we see a number of startups and other organizations, companies that are really leaning on technology and developing tools. Oftentimes, though, we see those tools being developed without the inclusion of the family caregiver. And so if you are in that space, one of the pleas that I always make is that if you're developing these things, to ensure that you're being inclusive of the family caregiver, either really researching what they need and how they'll use it, or bring them into the co-creation of these different adoptions. We know that more than half of family caregivers have unpaid help. And so we see that family caregivers are leaning on family members, friends, members of their faith-based communities, and others to really help provide that support. And the other piece is oftentimes we look to the family caregiver to reach out for support. But again, if you as an individual have someone in your life, whether it's a coworker, a friend, a family member that is currently a caregiver, we also encourage you to reach out and provide help and assistance there. And then finally, new payment opportunities. So we are seeing through programs such as Medicaid, the Veterans Administration offers support stipends as well. And there are also other resources from state to state. We see that 11.2 million family caregivers are now receiving some form of payment as they're working to provide that care. I know at AARP, one of the things that we get in our discussion group all the time, the number one question is, how can I get paid to do this? And so there are resources, and while still limited, we are very pleased to see an uptick in the offering of those and also in the utilization. And then finally, what do caregivers want? You know, we often talk to caregivers. That we were very pleased in caregiving in the U.S. This really is about learning about the caregiver. And this year in particular, we were very focused on who is that caregiver, not only who is that caregiver and who they're caring for, but what do they want? What can we do to better support them? And so what we're hearing from caregivers is that more than 2/3 of them are supporting payment programs. So again, resources such as being able to get paid through a Medicaid waiver program or other community resources, especially those with lower income. Folks are saying we really need more support. We really need help to be able to not just care for that individual, but to ensure some financial stability for ourselves. We know that more than 2/3 find that income tax credits are valuable. And this is particularly true for higher earners, so those that are making over $50,000 a year. Out-of-pocket expenses continue to grow, and so the ability to recoup even the smallest amount is something that can go into a caregiver savings account or be used in another way. We know that more than 1 in 3 want respite services. So that is really the ability for a caregiver to receive support, whether it's in home, whether it's taking the person that they're caring for somewhere, but they need that additional time. They're seeking that time to be able to take care of themselves and do the things that they want to do for themselves. And then finally, 1 in 3, they want caregiver needs assessments by healthcare professionals. All too often, we see family caregivers that are sitting at the bedside in a hospital or going into community to a family doctor with the person that they're caring for. And nobody, not only doesn't acknowledge, the providers don't acknowledge them, but they're not assessing what they may need in order to not just better care for the person and that they're caring for, but to also care for themselves. And so they are really seeking someone to see them as that family caregiver, as that individual.
Great. Thanks so much, Rita, for that overview. And I think this really provides a roadmap for how our organizations, and I can speak to the National Alliance for Caregiving, really will approach how we leverage this data moving forward to champion investments in the infrastructure that we need in order to make caregiving more sustainable, more dignified, and more equitable. And this represents some core areas of opportunity and investment, so that we could better focus on the purpose associated with care and less on the challenges and hardships associated with care. So this data is not the end of the road, it's the beginning of the road in terms of how we translate it into action and into change for family caregivers, especially in this environment where caregiving has never been more visible than it is today. Yet it's never been more under threat as well in terms of how hard it is to provide care, and our data really bears that out. So tremendous opportunities and urgent need to address the challenges. And we have tools to help you do that too. So one, you can access the report. Here's a QR code that takes you to access the report. You could also find it on AARP's website. Really rich resources, including an executive summary, subgroup fact sheets around race, ethnicity, disability, income, gender, and more. Frequently asked questions about the report, interpretation, analysis, context for care as part of a larger care continuum, really rich complementary resources that we've developed for caregiving in the US 2025. And then we have more coming. In October, we're very excited that for the first time we'll be releasing state companion data as part of caregiving in the US. This is really critical as so much of the change that we're seeing is happening at the state level. So we are excited to be able to release state by state data on the challenges of family caregiving. So stay tuned for a late October for access to really exciting state profiles on family caregiving tied to the national insights that you've learned about today. We'll also release from National Alliance for Caregiving a data dashboard in November to make this data more accessible beyond the static PDF that you have access today. We'll continue to develop that over the next 5 years and the life of the project to make this data come to life alongside stories and data visualization. So stay tuned for that. And then we have robust secondary analysis that'll be released over the next year related to 50 plus caregivers. So really looking at caregiving across generations. And then also caregiver health and wellness, taking a deep dive into the health insights that we've seen on family caregivers. And then we'll be releasing on the National Alliance for Caregiving side data briefs around financial well-being and chronic disease caregivers that align and take a higher view around some of these insights. And I would be remiss if I didn't thank the partners who made this project possible from the National Alliance for Caregiving side, especially and including AARP. But really, we brought together a really diverse set of partners to support the vision of caregiving in the US, and we're grateful for their investment and sharing a vision for a more caring future with us. And with that, I'll turn it back over to you, Lisa, for a conversation.
Great. Thank you so much. I am so thankful you shared the QR code. I encourage you all to visit AARP's website, National Alliance for Caregiving's website. There were a couple of questions about accessing the materials, helping to amplify the story about caregiving, and absolutely encouraged. One of the sort of core tenets of this project is to get the word out there. So related to the conversation today, I have a couple of questions in the chat. I'm going to start with the more specific one about workplace benefits. So the question is, I noticed you did not mention dependent daycare benefits plans, typically a flexible spending account where you might be able to allocate some dollars to that account to then pay for essentially adult daycare services for your care recipient. Does that have a role in caregiving, and how might employers better support caregivers with benefits?
Yeah, I can jump in on that one. There are a number of benefits that we didn't mention. I mean, I think one of the good pieces of good news is that there is an ever-growing opportunity for employers to recognize where the need is and how to better offer those to their employees. From an AARP perspective, when we talk about workplace benefits, we do a great amount of work with employers. We have an employer resource page, which I can pop into the chat at some point, and are always looking for ways to engage employers to help them better understand the needs of their employees who are family caregivers, but then also to create an offer. Well, we don't create, but to talk about existing benefits that may be available. I think while we're on this employer topic, the only other piece that I would add is, as important as it is to have a benefit, a tangible benefit, it's also equally important to ensure that the workplace culture supports family caregivers. And so you can have wonderful, wonderful benefits, But if you have a manager who does not understand how to support their employee who's a caregiver and doesn't provide access to those benefits, then that becomes challenging. So I appreciate this question in terms of broadening the number of benefits that could be available, and really think it's important for employers to really begin to dig deep and do more work to support their employee caregivers.
Yeah, and I would endorse everything that Rita said and then build on it to say that we also need the tax code to do that same kind of work to recognize and see and value caregiving, right? So from what can be used, how can flexible spending accounts and health saving accounts be used in support of caregiving responsibilities? How can we introduce things like caregiver tax credits at the federal level, which we see some states like Nebraska and others start to step up and establish caregiver tax credits. So there's room for employers to play an important role, but there's still an urgent need for the federal government to say, hey, we all value from family caregivers and their contributions, and we need to start recognizing that from how we incentivize employers to engage and support family caregivers to how we do that ourselves as the federal government through the tax code.
So I will expand on your answers because I do think that we see from some of our research, we know a lot about benefits and benefit use. And a big barrier tends to be that employees don't understand the full scope of benefits. So what role does education have here for employers? Is there something they could do to better serve caregivers?
Yeah,
Yeah. Oh,
absolutely.
go
Go ahead,
ahead.
Rita.
No, I was just going to say absolutely. And I think we're in a key time right now. I mean, we're headed into open enrollment, right? And so I know within AARP, our HR, my HR colleagues, our HR department, they do a very good job of taking a look at the benefits that are offered and explaining how those apply to family caregivers, how you as a family caregiver can benefit from some of these resources, whether that's backup care that you traditionally would think about just using for your younger child, but now you can use it for elder care. We also have we actually have caregiver leave. So explaining to individuals that you can take these 40 plus hours and use them to take care of someone. So it really is important for that HR component of your organization to do a good job of explaining these things to your employees.
Yeah, I would definitely agree. And I think we think about kind of benefits as like having policies in place is necessary, but not sufficient to create supports and sustainability for caregiving, right? So how do we ensure that employees are aware of the benefits that they have access to and understand how is it part of onboarding? How is it part of strategically positioning yourself as an employer, right? Thinking about care benefits as a competitive advantage compared to other folks in your space. So I think there's more that we can do to raise the visibility of these. And when we see, I think your research has borne this out. I've done some research on paid family leave, including in states like California, where there is a robust paid family and medical leave law on the books. But what we see is there's underutilization of that existing benefit because of a lack of awareness and how to navigate utilizing those benefits, especially compared to something a little easier like sick time in terms of utilization. So that education becomes really important, and that leads to something that Rita said earlier, sort of that culture of care that needs to be within workplaces. So having an HR manager that can help walk you through it, but also seeing your manager, seeing your C-suite use caregiving, talk about their caregiving benefits. One of the most powerful things that I've seen is one of our member companies at NAC is Pfizer, and Pfizer's chief executive officer talks about the care that he's provided and the time he's taken to provide care for his daughters with complex conditions. So that sends a really powerful message that if you see your C-suite utilizing care benefits, you might feel a little bit more comfortable asking about those same benefits and utilizing those same benefits.
So one of the other questions in the Q&A, it was related to something that I wanted to talk through with you all is, we have a variety of people on today's webinar from across financial services, benefits, health insurance landscape. Is there a role for those industries to play in supporting caregivers? How might they do that? How might they better support this population if they're not directly a physician or a medical care provider organization? How can they better support caregivers?
I can jump in. I think there are a number of ways, and I think a really important way is the awareness and recognition. And so, if we're talking about financial service organizations, I'll just start with them. Um, how are you, as that wealth advisor? How are you, as someone really helping help individuals understand their retirement? How are you building in this conversation around providing care, around caregiving? We talk about creating college funds. We talk about creating retirement funds. We even talk about vacation planning and wedding planning. Somehow in there, the conversation around long-term care and caregiving doesn't get built in, and it could be more expensive than everything combined together. And so I really think looking at, and I think financial advisors and the financial system in particular has a really, really critical role. I just talked about the negative impacts that family caregivers face around finance. I think we do such a disservice to individuals at all income levels, quite frankly, in terms of being able to help them plan and really take a look, not just for caring for someone else, but what is that care going to look like for yourself and planning for that care. So I think it's very critical to have the financial industry and those that work within the financial industry, especially those that are doing direct planning, to really be educated how to have these conversations and help individuals plan for care. And that's across the spectrum.
Yeah, I couldn't agree more. And I think I think Rita covered really nicely the financial services and planning opportunity. And I think that same opportunity exists in every sector, right? So from a benefits manager and executive, as you think about total rewards for your employees, you should really think about the caregiver dimension of that. What does that look like? Not just for, so many employers have benefits in place for parents, really thinking about, well, what does that equality look like, right? Between if I have a benefit that I introduce for parents, what is the counter to that or the mirror benefit for folks that are balancing care for an adult or a spouse, right? And especially given the stats that we see in our data that 1 in 3 family caregivers are sandwich caregivers. So you might help one of your employees shoulder their parenting responsibilities, but that only gets you halfway there, right? For those individuals who are balancing both. So really thinking about that comprehensive support across the care continuum from a benefits perspective. And there are so many solutions now. We, including in our membership, have folks, companies like Clio and CareLoop, who are really thinking about how do I coach and support individuals across the spectrum of care and across the complexities of care. So they're really rich solutions, but it really takes folks thinking about caregivers as a segment that need to be supported as part of a total rewards and retention strategy.
Okay. Yep, that's helpful. And I think from a manufacturer perspective, people developing benefit solutions, people creating retirement plans, people sort of going out to market, there's product implications there, right? Can the emergency savings benefit that you offer also have some communication components there for caregivers? Oh, hey, this is how you might use this benefit.
Yeah, absolutely. And I think so few, I mean, this goes kind of back to like policy is necessary but not sufficient, because you have to think about, how do I even know who to message that to, right? So employers need to do a better job of asking their employees about their caregiving responsibilities. And not everyone's going to share. What we see in our data is that there's still a significant population of caregivers who are employed either part-time or full-time, who don't tell their manager about their caregiving responsibilities because of that lack of support in place, because of a fear of what that could mean for their careers. But there's a significant portion, I think the majority, who managers do know about their caregiving roles and responsibilities. I was on a panel with one of the senior people leaders at the San Francisco Giants, and they talk about, she knows the exact percentage of folks in their organization who have caregiving responsibilities,
Wow.
because they factor that into the kinds of benefits and the kinds of ways they communicate those benefits to their employees. So there's a data collection component there in order to inform what products you need in order to support your employee base.
Great. So Jason, you mentioned a couple of your partner member firms that are creating innovation or change technology, right, to support caregivers. And I'm just curious, what kinds of developments are you seeing in innovation and in supporting caregivers that are making you excited?
Yeah, that's a great question, right? Really focusing on the glows. What we're seeing is like more employers are fostering innovation in supporting and identifying their caregivers. I just gave a great example of the San Francisco Giants, like actively asking, how many of y'all are providing care, right? I want to support you. That's why I'm asking. I don't want to, I'm doing it in a way that I want to provide support. We're seeing employers like Genentech, who are thinking about, how are my different benefit partners, innovative service providers, sharing data to see how providing benefit through one vendor leads to impacts with another vendor. Sort of that kind of innovative data sharing in the spirit of improving supports for family caregivers is something that I think is really new and exciting, as folks start to understand that, hey, my investments in caregiving employees is an investment in retention, and it's an investment in competitiveness with my peers. And so those are some exciting developments.
And I would just add, I think, and kind of sticking to that employer piece, but building in a healthcare piece, we are seeing an increase of healthcare systems, hospitals, systems across, looking at their own employees again, and recognizing that caregiver fatigue, and recognizing that they're getting it by being a caregiver to others in their workplace, but also knowing that they're doing this when they go back home as well. And so we're seeing an increase in questions around, how do we better support these individuals that are doing it at both ends? What we're also trying to do then is make that leap for them to see not only how you as a healthcare system can support your own employees, but how can you support that caregiver at the bedside? And so again, I think this idea of what we're seeing, an increased awareness writ large of family caregivers and what they're doing, is starting to take some hold. And it's slower, but it's starting to take some hold across all sectors. We're seeing it in retail, we're seeing it in healthcare systems, through employers. I think a really important piece that needs to happen now is, we don't need a million different solutions, right? How can we take some of the promising practices that we're seeing from current solutions, or those that are in market now, and how do we scale those? And of course, you'll have to tweak them to meet different target audience needs, but let's do awareness and continue awareness. Let's begin to build products, but then let's grow them and scale them.
I have a question that sort of you brought to mind, because I keep feeling like caregiving's having a moment, right? We've done this for a long time, all of us on this call, and it feels like it's very much in the zeitgeist. I don't know if that's coming out of COVID. I don't know if it's just that people are more willing or able to talk about their situation, or if social media is helping drive the narrative. I'm just curious, What's your pulse on this? Do you feel like caregiving is having a moment, and sort of why you think that's happening?
Yeah, I think all of the above. I definitely we're at a tipping point for visibility around caregiving, right? And we've seen that in all aspects of American society, from the media narrative around caregiving, seeing representations of that in shows like The Pit, where for the first time I've heard on a scripted television show the phrase area agencies on aging, right? Like talking about that in the context of providing care and caregiving, to reality TV. You know, you're just seeing narratives around caregiving more and more in the media. We're seeing it more in the policy realm as well, right? We saw that in the last administration around Build Back Better. For the first time, caregiving policy seen not just as family policy, which it certainly is, and that's important, but also as economic security policy as well. So there's greater visibility around the role of caregiving. I think that ties to our data. There's just more of us who are recognizing, hey, what I'm doing is caregiving and it deserves support because it has impacts and it has tremendous public good. And that really is the paradigm shift that we need. We need to move beyond visibility to the recognition that caregiving isn't just an individual responsibility, it's a shared good that we all benefit from that deserves investment and support.
Yeah, and I would add and agree with everything Jason said. And I would add something that's just been sitting with me for quite a while now is the sense of community among caregivers. I think that no matter where we are, kind of you're saying we have their caregivers are having a moment. When I think back to my caregiving, as I said, 15 years of caregiving for my mother, there wasn't a real strong community of caregivers that I could necessarily lean on because people were still a bit shy in terms of being very vocal with what they're doing. But when you look at caregivers, whether it's through social media, whether you look through the organizations such as NAC and AARP and others that are elevating those caregiver voices, what I'm seeing is a community, right, that is building and that is getting stronger, and a community that is not afraid to say to their employers, I'm a caregiver, I need help in this way. That is not afraid necessarily to go into a healthcare provider and say, I don't know how to do this. I need you to show me. And so I think with these different vehicles that are being provided, these caregivers that are now in community and see each other more often, whether it's at the grocery store, in their faith-based community, or sitting next to them at work, or online coming through every day, there's this community that is growing and making that voice stronger.
So we are really close to time, but I want to wrap up with one last question. Caregiving in the US is done every 5 years, right? And while it seems far away, it's not 2030. What would you love to be able to say in 5 years from now? And what do we need to do to make that happen?
Wow, you saved the hardest question for
And
last, right? Um, I mean, I would love to be able to say that in our data, the glows have gotten brighter, right? That one of the consistent things that we've seen is that consistently family caregivers over half find that sense of purpose as a part of their care situation. That hasn't increased. It hasn't gone down, but it hasn't increased. I would love to see that number increase because we've addressed some of the challenges associated with the lack of support for care. And what that's going to take is us being consistent in our measurement efforts, but also taking that data and using it, right? Equipping advocates, equipping partners to use that data to champion investments in addressing the challenges that come out really clear in caregiving in the US.
And I know we're at time, so I'm saying yes. And I would love for us to be able to show that at the very local level. We're releasing the state data, so the ability in 5 years to drill down even further to show that community level piece would be really wonderful.
Well, thank you both so much for your time today. And thank you for walking through the data. Thanks to our audience for joining. and hope everyone has a great day.
Great.
Thank
Thank
you
you.
so much.
Bye.